This is the case of a distal humerus supracondylar simple fracture. The patient has not important medical history and soft tissue status is okay with a closed fracture and no swelling impeding the surgery. X-rays show a simple supracondylar fracture with translation to the anterior medial side. In the decision-making process, we decided to do an anatomical reduction with absolute stability. This slide allows you to think of other options and to make a better approach to the case. This also allows you to write your plan, taking into account critical steps. Once you have decided your plan, it is time to pass to the OR disposition. Patient will be in prone position, the anesthesiologist on the left side of the patient, and surgeon assistant, and the nurse on the right side of the patient, with the C-arm on the head of the patient. This will give a space for the surgeon assistant and the nurse to get out when the C-arm goes in. Screens shall be facing the personnel. Once you have your plan ready, it is time to calibrate the images one to another. Ideally, they should be orthogonal projections. You can use the image of a ruler adjusted to any measurement made over the X-ray image before exporting to JPEG format in order to be more precise in planning. You can use an included filter to highlight borders in order to provide a simple, easy to understand final image. This tool can be found in the upper toolbar under the icon of Artistic Effects. Usually, this is the last one of the list. The next step is to make segmentation of the image according to the main fracture fragments which want to be reduced on the image. Copy and paste one X-ray for each fragment in order to manipulate each image of the fragment individually. You can see that the distal fragment is being cropped. Then, with the background removal tool, which is also in the upper toolbar, erase the proximal remaining fragment. The tool allows you to draw which part you want to keep and which part you want to erase. This process can be time-consuming, but as you do this process, your understanding of the fracture will improve. Then, repeat the process from the main proximal fragment and, if it is the case, with other big fragments which want to be reduced. After segmentation, only move the distal fragments over the proximal to restore the joint alignment, bone length, and articular congruence. You can compare with the last slide when the fracture is shown displaced to see how reduction of fragments change the anatomic panorama.